This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Stacy Poehler.
Hey, everybody. I'm excited to be talking with Dr. Korry Tauber. He is the owner and founder of STABLE Orthodontics. Welcome, Dr. Tauber.
Hi, Stacy. Good evening. Good to see you.
Yeah, I'm excited to chat tonight. So I think you and I are going to have a little talk about understanding your child's growing smile. Definitely a timely thing for the summer, right?
Exactly right. So when kids are off for school, we definitely see more young patients and kids coming in while the summer is in session. So what not a better time to talk about your child's growing smile? Awesome.
Well, what's the best time to bring a child in for an orthodontic exam?
Yeah, that's a really good question. The American Association of Orthodontists generally recommends that a child be seen by age 7. And the reason for that is because the permanent teeth can be seen in an x-ray, and we already start to see permanent teeth coming into the smile. We want to make sure that we take an early look, because it's at that point when we can really make sure that there's nothing that's happening that, if not corrected early, would lead to something more serious happening. So generally age 7, but we always tell families that if you see something that you're unsure about, go ahead and go see an orthodontist to get that look, have them take a look at your child's smile. And at our office at STABLE Orthodontics, we have a young kids program called our Kid Corral. And this program is actually geared towards children even younger than age 7. It's our goal that when they come in, they get used to having somebody look inside their mouth with a mirror. So we make lots of fun with it. We give the kids little masks to wear on themselves and give them their own set of gloves. And we hand them a mirror. And it's just an opportunity for us to get to know the young child and have them used to having somebody look at their mouth. So when they do have the full exam at age 7, they just feel comfortable with us being around them.
Awesome. And what are some things that people can expect at that exam? What are you going to do?
Awesome question. So this is really, really easy. The first thing we do is we take one x-ray, and from that x-ray, we get all the different amounts of information that we need. We look at the growing jaw bones. We look at the growing teeth and how they're erupting into the smile, how they're coming in. The other thing that we do is we take a few photos of the teeth using our intraoral scanner. So years ago, people might remember having a tray filled with goopy material that is not really comfortable and could make you gag. Those days are gone. So at our office, we take pictures of all the teeth, and that helps us create a digital version of the smile that we use on the computer to design where all the teeth are going to go. The last thing that I'll do is a thorough intraoral exam where I'll take a look at all the pink gum tissue and all the white teeth and talk about what we see growing and where teeth are coming into the smile. The whole thing probably takes about 40 minutes. It's really quick and easy, and we love giving parents guidance on their child's growing smile and how things are going as they're growing. So we take it as a really fun opportunity and make it really easy for everybody.
That's awesome. That's awesome. What are some of the things that you're looking for in that initial exam?
That's another really good question. So at these initial exams, we look for a few things. Some things are really obvious and some things are a little less obvious. So one of the things that we know, if a child sucks their thumb or finger, that can put pressure on the teeth and move teeth in an unwanted position. So we ask the family about any finger sucking habits. The other thing that we look for is a tongue thrust habit. So just like the thumb can push the teeth back, the tongue can actually push the teeth forward from the inside out. So we look at swallowing techniques and how the child is using their tongue and how it's whether or not it's pushing on the teeth. We also look at how the teeth are coming together when we bite. So we're looking to make sure that the teeth aren't coming together when they chew in a way that can cause damage to the lips, cheeks, or tongue or adjacent teeth. We look to see if there are any extra teeth or any missing teeth. That's actually quite common and more common than you would think, just because generally speaking, everybody might have their teeth. Some people don't. And we often you get this information from the x-ray that we take, but often we even find extra teeth. So even twins have teeth that are different. So every exam that we do, we have the opportunity to find something that's not routine. The other thing that we look for is how the jaws are growing. So I don't know if you've ever done this, but if you've taken a picture of yourself and used the mirror tool to see what the left and right side of your face would look like, oftentimes the left and right sides of the face are different. And in a growing kiddo, sometimes these differences can be really drastic and change the way that someone bites and chews together. And sometimes they're not very different, and that's okay. But we do assess for any jaw differences or asymmetries. We also look for teeth that are particularly crowded, that don't have enough room. And we also check for teeth that could be spaced out. And then the last thing that we look for, especially at a young age, is how does the child feel about their smile? One of the things that we see is that kids can be really self-conscious about their smile and where their teeth are positioned. And they can also just not feel the most proud of their smile. So even in a youngster, we talk about straightening teeth to help improve self-esteem. So that's another opportunity where we have a conversation with families to talk about what time for orthodontic treatment is right for them.
Awesome. Awesome. So what are some things that can actually be prevented if a child is seen early and you're able to do this thorough exam?
Yeah. So some of the things that we can prevent is we can prevent teeth from coming in where they don't have enough space. I tell families often that sometimes we have 2 cars and 1 parking spot, and we want to make sure that every car has its parking spot. So just like in a growing smile, we want every tooth to have its proper space and position to come in to the bite. So that's one thing we look for, and that can be prevented. Another thing is if the child doesn't have an exam early enough, it might mean that because we have so little space that we might need to take out some teeth in order to make everything fit into a perfect bite. So coming in for an early exam can prevent the need for tooth extraction.
Wow.
Some of the other things that we can help prevent are redirecting growth and prevent abnormal face growth, and even preventing unwanted damage or wear on teeth because they're not coming together and being used in the proper position. One of the last things that we can help prevent is making sure that the speech that the child is developing is not being affected by the position of the teeth. So oftentimes if a child has an overbite or an underbite, then they're accommodating for the position of the teeth. And because of that accommodation, we can be talking a little bit differently. So we have seen and have helped families whose children are in speech therapy actually progress through speech therapy and graduate from speech therapy because we've rearranged the position of their teeth. And that's been pretty cool. So not only do we see their smile change, but we also hear their speech change. And that's pretty powerful.
So are you doing early interventions then, to these children who have these problems? What are some of the things that you're doing to help them, with the speech, or with the crowding and things like that?
So in our young kiddos, you might remember or hear people talk years ago. When I had braces, I was in braces for 5 years or for 6 years, and I was in my braces forever. And the thinking at our office is that's entirely too long to have braces. Some of the hardest things about having braces is keeping the teeth clean, and having them on the teeth for that long really kind of brews an opportunity for hygiene to get a little worse than what we'd like to see. So I use this example with a lot of our young patients. I ask them, I say, well, how do you eat an elephant? And they look at me a little funny. And then I answer and say, well, one bite at a time. So what I mean by that is we can take a big problem and kind of split it up into smaller bites, smaller things. So with early treatment, we make the decision to say, okay, what we're going to do is split up this big problem into two little parts. And we call that two-phase orthodontic treatment. And the first phase usually happens when the first half of the permanent teeth come in. And at our office, I really like to limit that to 12 months or less. And then once we have solved that problem, we take all the braces off, or we take out the appliance or the expander, and we let the child continue to grow and allow the rest of the back teeth to come in. And then once the permanent teeth do come in the back, anywhere from 12, 13, or 14 years old, we reassess where the bite and the smile is and discuss if there's any need for additional orthodontic treatment. So what we've done is really take this window of time that is about 5 to 6 years and split it up into two smaller pieces to make everything a little less involved and solve a problem a little more easy.
Awesome. I imagine the summer is also a good time to come in and get a custom mouth guard, getting ready for fall sports. Can you talk about your process for that and what you offer in your office?
Absolutely. So we absolutely love our Guard Your Smile mouth guard program. We love how active our community is, whether it's playing sports or doing martial arts. And we know that having a custom fit mouth guard is one of the best ways to not only protect your teeth, but actually protect your head from concussions. So the mouth guard, when it's in place, can protect the head and mouth from a lot of different injuries. And we know that the best fitting ones and the ones that the kids wear the most is something that is well fitted. And we create custom fitting mouth guards for all of our athletes. And we enjoy making them because we can personalize them. So we can use team colors, we can use your child's sports number, or their position, whatever it is. If you could think of it, the color and the design, we can put it on the mouth guard.
That's super cool.
Yeah, we love some of the designs that our kiddos can come up with. I mean, some of them are really, really, really unique, and some of them are really express their personality. Yeah. So with your Guard Your Smile program, families and teams can sign up as a group, and we will either coordinate a visit at the office, or we can actually go to the fields or the studio and take a custom scan of everybody's teeth. And then in about 2 to 3 weeks, we can turn those around into a custom fit mouth guard. So it's something that we can help the community with, and it's something that we love to offer. If anybody is interested in the Guard Your Smile program, you can go to our website and then click the drop-down menu for Guard Your Smile.
Awesome. Awesome. And so why don't you tell us, where can people make an appointment? What's the best way to get in touch with you for scheduling a Kid Corral appointment or the Guard Your Smile? Yeah.
So our website is www.STABLEOrthodontics.com. And if you're interested in a complimentary new patient exam, right in the front on the homepage, you can click Book Now or Schedule Consultation. If you're interested in our youngsters Kid Corral program, you can click the drop down on the top bar for Kid Corral. And there's a registration page at the bottom of that page. And in the Guard Your Smile program, there's another drop down on the top that says Guard Your Smile. And you would sign up the same way. You can sign up just your individual athlete, or you can sign up your whole team for us to get in touch with. So 3 really nice opportunities to see us at Stable and for us to help you out in what your child loves to do most.
Awesome. Well, thank you so much for joining us today, Dr. Tauber.
Thanks, Stacy. Good to be a part of it.
Yeah.
Thank you for listening to the Good Neighbor Podcast, Milton and More. To nominate your favorite local businesses to be featured on the show, go to gnpmilton.com. That's gnpmilton.com. Or call 470-664-5600. 4930.